horses move into pain. I think humans, in fact, I know humans often back away from pain.
Welcome to the Reframe, where we have real, unfiltered conversations about mental health, parenting, and addiction treatment in a changing world. Hosted by Doug Bodin, a therapeutic consultant with 35 years of experience, we explore the shifts shaping mental health care, featuring experts pioneering new approaches and offering practical advice. Join us as we challenge old narratives and reframe the way we think about the challenges in mental health treatment. This is The Reframe. Let's dive in.
Today, we're joined on The Reframe by Dr. Rob Magnelli. He's a clinical psychologist with nearly 5 decades of experience working with horses, and he is a pioneer in the field. Since the early 2000s, he's been at the forefront of integrating horses into mental health treatment, combining clinical expertise with a lifelong passion for the profound emotional connection between humans and horses. Rob, welcome to The Reframe.
Well, it's great being with you, Doug. Again, we go back a long way, like a lot of years, over 20.
I think it's closer to 30 at this point.
I think it is. And I remember our connection actually and how that happened. That was one of the references I had. But I believe we kind of started out, you had been very involved in wilderness and wilderness therapy, which I believe in very strongly. And I believe in wilderness, and I spent a lot of time out there. And that's really similar in some ways to equine therapy in that neither one is about purely talk therapy or sitting in an office and discussing. It's more experiential. And I was impressed when I got to know about wilderness, and I referred a number of people to you. And the link over with equine work was easy because it's also experiential and it's not cognitive. It's relational and connecting. And so the two got together pretty easily. I remember our first session when you came to the ranch, we're up in Corral Valley. I think you had in fact, I know you had one of your BMWs, and I believe Marcello was trying to improve the paint on your hood.
I think he took a bite out of my first BMW. That's right.
That's right. I thought you said that. He's eating your car. Well, that was the beginning of our friendship, where that horse of mine attacked your BMW and ate part of it, and you're a fan of cars. I am too. So it's been a pleasure knowing you all those years, and we've referred and co-referred and been friends, and most importantly, 49er advocates through thick and thin, even though it's been thin recently. It's going to get better, I hope.
I don't think we should start talking about the Niners, Robert. We were not going to get through the rest of this podcast.
Can I talk about Bosa? No, never mind. Okay, I got it. So yeah, shoot away, and I'll be glad to try to answer.
Give us a couple minutes on what is equine therapy, because I know when I talk about it to people, and they unless they really know something or have heard something about it, they just don't know what it is. So why don't you just tell us what is equine therapy?
Great. I will do that. And in order to do that, I might do a minute or a couple with why horses and what is it about horses in equine therapy. There are other therapies. Dogs are wonderful creatures and wonderful companions. But dogs are from a predatory nature. They come back from the wolves and they're hunters. Horses are prey animals, and they're the ones who have to be wary and be alert. And that is core in equine therapy. And quick facts that I was shocked to learn 25 years ago, horses sleep about 2 hours a day. They're awake 22 hours, and they scan their environment either with their eyes or their ears or their bodies, feeling energy, once a second for 22 hours a day. So they're super alert and super aware, and that's how they stay alive and have done so for, some people think, 50 million years. They've been alive. And so they're so alert, they are keen in picking up our body language. They obviously see that, but they also pick up our intent and our emotion and our attitudes. Why do they do that? I think it's because they learn that from reading predators. A mountain lion is not growling like on the television, big lion with the studio. Lions, when they're hunting, act indifferent and almost they disappear. So they don't show any sign of aggression. And the horse has to read this lion is just going to get water, or I'm going to get the whole herd up and we're going to stampede out of here, whatever that means. So they read intent and emotion, and it blows me away how they do that, but they do it. And then as they do that, people start to get a connection started. And this is all about connecting. I do some talk therapy, but a lot of talk therapy is cognitive. It's even called that, cognitive behavioral therapy, CBT. It's well known, well researched. It's cognitive. Equine therapy is connecting, and it's a connecting experience like wilderness, where there's a connection up in the wilderness that you can't do in an office. I think it's the same thing with horses. So with connection is healing, and our motto is connection is the vehicle for healing. So when we do equine therapy, we've got these sentient, aware, virtually constantly watching and sensing us creatures. And in the midst of that, that connection forms, changes happen in our body. Horses' hearts weigh 12 pounds. Ours weigh 12 ounces. The electromagnetic energy, which is measurable from our heart, which is tangible, goes out 5 to 10 feet. The electromagnetic energy from a horse's heart goes out 50 to 100. And in thousands of people with whom I've worked, at the end of the sessions, I'll always say, how are you? What do you feel? And almost always without a cue, they say calm. Well, that calmness and that calmness in the brainstem allows the neocortex to start functioning. When we're in sympathetic nervous system, fight or flight or feign, those three, our mind isn't working very well. We're trying to survive. When we're in a relaxed state and a calm state, the parasympathetic takes over. That's like digest, rest. For Italians, it's eat. Those are resting responses. And when we're in that, our cerebral cortex starts to work. So we start to link the thinking part of our brain with the emotional part of our brain. And that's where the connection starts. And that's where changes start to occur in psychotherapy with equine partners present. And that part blew me away when I started doing it. And no knock on the other, I do it. And I've got good friends who do a lot of office work, and it's effective. But the work with the horses was really attractive to me because I saw changes happen very rapidly as the connection increased. The cognition was diminished. The connection was improved. And as that relationship formed, people started to make changes and improve. It's not hanging out with horses, and it's not horsemanship, and it's not riding. It can be riding, and I do ride, but most of it is being in the presence of these huge sentient creatures as they move in close to us.
Well, let's talk about some of the data that backs up the efficacy of equine therapy, Rob. The physiological data. Great. And what we've seen with outcomes and research.
Thank you. As you might imagine, I went through my PhD studies and the statistical background. In fact, I minored in statistics in order to capture it and figure it out. And when the equine therapy possibilities came up, my mind immediately went to efficacy or effectiveness, which is the same thing. And I thought, is this stuff real? It's fun, and I love horses, and I've already loved horses, but is it real? So there are two main avenues. One was research that we did ourselves, and we did pre-post testing with an instrument. You're probably familiar with it from Wilderness, Doug, the YOQ, Youth Outcome Questionnaire. And we used the YOQ with an N of 137 in one study and 19 in the other. And we got highly significant, statistical significant change with as little as 5 2-hour sessions, which is kind of unheard of. But when we went through that, and actually the specifics of it that we got, somatic complaints, including anxiety, depression, and the symptoms thereof improved. and were reportedly reduced. And we have interpersonal relations got better in as little as 5 sessions, and behavioral dysfunction diminished. And those were highly significant statistics in the days that we weren't getting statistics. And I have those in the manual, the horsepower tool book, which we sell internationally. And the statistics are there if anybody wants to look at the t-test and the two-tailed teeth that we did. But they were very significant. And a student at Columbia University did our statistics. So it was blind to me. I had no idea what the outcome would be, but we were blown away with it. Secondly, findings now, a good friend of mine is a molecular neurologist at Stony Brook Hospital in New York. And he sent me some data about brain changes and neuro brain changes. And I went into the research about how the EAP programs affect it. And specifically, number one brain change on MRIs was that the part of the brain called the caudate function, which is deep in the brain inside the basal ganglia, and is basically the emotional center director of the brain, if you will. That is flexible and connects with the thinking part of the brain, improved with equine therapy. So it means people aren't just emotional, they think better, but they think better because they're in touch with their emotion. And when emotion and thinking are united, the outcome is better. Usually they're separated and they're seen as contraindicated. But that caudate function, which is down in, again, basal ganglia, central part of the brain, changed on MRI studies very rapidly. So that's statistically solid. And secondly, salivary gland studies of cortisol, which is a hormone, it's a stress hormone. We all feel it. Those stress hormones also diminished significantly after equine therapy session was over. And so that calmness that I was talking about, when our brain stem calms, our neocortex functions, and we can make new connections and changes in our lives as a function of connecting with the horses. The horses don't judge, but they read us. They don't criticize us, but they watch our responses and they read our emotion and our intention and our attitude, and they replay it back to us without judgment. So when I'm around horses, I learn a lot about myself, but it's not coming from a critical stance. It comes from information. And that's how I learn. And that's why equine therapy has blown me away. And through all these years, I've done it.
Rob, help us connect the dots. How does the science affect the actual session? What goes on in an equine-assisted psychotherapy session that helps affect these types of changing that you're seeing significantly and statistically?
Great question. And this is what keeps my blood pumping. In preparation for this podcast, I was trying to think about the thousands of sessions I've had and results we've seen. And we've got statistical findings with the YOQ, and we've got changes in caudate function and heart rate variability and saliva. But really what happens when people come and connect, there are changes that happen inside because it's like no other experience. And briefly to say this, I'll never forget this, and this involved a horse. Her name is Bella, and your daughter knows her and knew her 20 years ago. So she's pretty old, but she's also standing 50 feet from me right down that hill and gets a lot of carrots every day. This young person came with a small group from the Boys and Girls Club came, and we had children from there and also from different parts of the school system in a town near us. And this young man was standing on the outside and didn't get involved in the talking about the therapy with the horses. He kind of folded his arms and refused to say anything. And he was quiet. And he was also kind of a leader of the other kids. He was a tough guy, basically, at least he thought he was. So he was there and very quiet. And I was watching, and we went through the session, and he didn't smirk, but he didn't join. He just would not come in. So we watched. And at the end of the session, the horses, when we stop, they leave the area and they run up to a place where they all eat up on the hill. So there was a herd of 8 of them, and they all started running. And Bella looked over and watched this young man did a pirouette, stopped and ran over to him and put her head over his shoulder. And we were watching that, and that was very unique, especially when a horse is going to eat because they're very voracious. Put his head over her, and the boy looked up, and she started to throw her ears back, which is a sign of irritation. And I was working with Nancy, my wife and psychiatric nurse and co-patriot in this, and she said, see if you can change what's going inside of you right now. And her ears perked up. And then they went back down. And she said, try it again. And her ears perked up. And after about 3 of those experiences, he got real quiet and had a very strange look. And the horse put her head down on his shoulder. And he started to close his eyes and he got teary, which is hard for tough guys in groups to cry. It's real tough. But he got teary and he looked up and we said, tell us what's happening with you. And his buddy, trying to block for him, said, he's feeling emotional because he likes the horse. And this young man said, I like the horse, but I'm feeling love. And he started sobbing, honest to God. And his tears ran down Bella's chest. And she put her head down. And as he sobbed and said, I've got a connection, man, she picked her head up and she trotted off to eat. And I'll never forget it. That boy is out of high school now. He's in college. And I tracked him. And he's done wonderfully since then. No activity with negative people. He got good grades and he got involved in college. He's now out of college and he's got a good job. And he still keeps in touch with us. That's Bella. That's what happens in equine therapy. And I could sit in a chair and look as intelligent as I can, asking him questions, and it wouldn't have done diddly in comparison.
And I know that, in the many clients I've sent to you over the years to work out there with the horses, and I have to convince them, and they'll say, well, I don't even like horses and I'm afraid of horses. And I know that every time I send someone and you report back to me, because it's always part of a plan that we're putting together for a family.
Right.
And for the individual specifically. And there's some similar type of story where there's been a breakthrough that I can't explain, but I've seen it happen enough times. And this is why I'm such an advocate for what you do and the general field, because I've just seen such transformative events like that in these types of sessions. And it's the experiential, it's the connection, it's the breakthrough that I see happen that often can't in a more traditional office setting, or that can take much longer, and that it's extraordinarily powerful. So,
thank you, Douglas. That's what keeps my blood pumping. And people ask me this insulting question of, well, when are you going to retire, Rob? And I'm like, what? When am I going to retire? And what, go bowling and watch the news? You ask me that again, I'll pop you. This is life. This is the experience of life. And those things keep happening, Douglas. And I can't explain it. I can just report it and be experiencing it along with my clients. And it's been profound. It's changed our lives. And I love every second we've done. And you've been a great supporter, referring people all the way from New Zealand and other wires to our programs. So I love that. And that is the experience. And it's hard to describe, but understanding what horses are, that's why I started with their prey nature. They're also herd nature, and horses move into pain. I think humans, in fact, I know humans often back away from pain. 2 weeks ago, I lost my 96-year-old aunt, and it was really heartbreaking. She was really my favorite, and she taught me how to be zany and crazy and do things. She put me on a horse when I was 3. She pulled me out of the drink at Lover's Point in Pacific Grove when I jumped in the water and went under at 3. I still remember her pulling me out of this cold stuff when I couldn't see clearly. Well, she just passed away. And some people were there. My Nancy and I, we stayed real close to her all through it, as did her daughter and her son-in-law. Some people didn't come near. They moved away from it because it was pain. Horses move into pain. When a horse is injured, the others come around and gather. And from a standpoint of evolution, the fewer horses, the more they are preyed upon. A larger herd has more ears and eyes and skin to pick up the electromagnetic energy of predators. So when they're tuned in and moving into pain, they're healing. If a horse is injured, the others surround it. If they're thirsty, they find water. They take care of each other a whole heck of a lot better than a lot of us humans do, unfortunately.
So
But
what are
it's
you
profound.
doing? Someone opens up in a session, the horse brings out the pain, they open up. What do you as a psychologist do in that moment that's helping that move from this openness, that connection that you're describing? How does that become a catalyst for the therapeutic work that you bring to the I was going to say to the table, but really to the corral that's going on?
Well, actually, the less in equine therapy, the less, in my opinion, the less I do, the better. Because then it becomes about me and what I've asked and what I am, and people are trying to please me or answer the question. The less I do, the better. That's an experience. And when it's over, we ask them to relate what did they find and ask them to follow up with like a diary entry or something to let us know what the changes are. And then we schedule, it's almost never one session. Usually 3 to 5. 3, we can get some contact, but the changes aren't that apparent on the surface, and they're not, people can't even repeat it. Like in cognitive therapy, you can say, oh, I just found how I can reframe my experience when I was a child at that school. And I reframed it and I feel differently about it. With horses, it's an experiential thing. It's like I felt different in my gut. And I did when I got home. And at night, I went to sleep and thought about it. And they replay it several times. If you've been around horses, even if they are eating your BMW, you remember the experience. And it doesn't come away. So really, the less I do, the better. And the more the people who are in that experience can evolve and talk about what they learned and then come back and build upon that for the next step. That's how it works. And it's got to be not a large series, but minimum 3 sessions.
Right.
Because at first it's like, oh, what happened? I don't even get it. I just feel kind of different. And that's probably based on the calmness that comes through. And 98% of the people, when I say, how do you feel, say calm. And I don't coach them in that. But that calmness opens the door for thinking. It also is, I should say, very powerful with post-traumatic stress. I don't say stress disorder. I don't like that bottom part of it. But with post-traumatic stress, calmness, as people calm their center, they can start processing what the trauma was and start to have an alternative response to the thought of the trauma. And that comes through once again with the equine work that they experience. It's not words, because words are just words, but it's a true experience as they go through it.
There's a couple of things I see going on out there and that I've seen evolve over the decades that I've been familiar with equine therapy. One, I think still people are fearful of it, or they don't know of it, or it sounds kind of hokey, right?
No.
And for those people, I say, just go give it a try. And many of the people that I've referred to over the years, I've had to basically just say, trust me, just go there, do it. I don't think I've had a single person who hasn't come back without a profound set of insights. And at the same time, I've seen a lot of programs over the years bring in equine, and they do it. And I'm not sure, and you and I have talked about this, sort of the general corporatization of wellness in general, but I don't know that it's always done with the level of passion, the level of connection that someone has to bring to it, that you bring. I know there's others that also bring that for sure. But maybe speak a little bit to what you've seen, how you've seen it evolve in the treatment world with treatment programs and your perspective on that.
That's a great question. And the word, the corporatization of psychotherapy, or the corporatization of medical care, hospital care. There's a corporation that bought up some hospitals not far from me, and the rules and the expectations, the patients they accept, the treatment programs, the amount of time the doctor has with each patient is limited and monitored. And I think it takes the human out of it. And the equine work it's funny to say, puts the human back in it because we're not that powerful. But the corporatization, I've thought, is there any way to do this? Can we put a camera in the ring and have them see the horse? I think it doesn't lend itself to the corporatization. And I think we're losing a lot in that corporatization of therapy because there's an algorithm. Oh, what's the diagnosis? Okay, here are the 3 treatment phases that we're going to follow. Cognitive behavioral, there's the outcome. Let's do it. It's too canned, at least for me it is. And I actually think, I think back to wilderness, profound, and I'm not just throwing roses at you, Douglas, but I do care about you. Profound changes. This young man that I'm talking about, that I'll never mention his name, it's profoundly changed. Profoundly. And when he left, he was in the tank and hated wilderness, by the way. Wasn't too happy about you, but he stayed with it and you stayed with it. And then he came back. He's a new man. How did that happen? It was the experience. It wasn't the corporatization of it. And I'm kind of skeptical of it, quite honestly. I think it's ruining healthcare in some ways.
The corporatization.
Yeah, and it's dollar focused, and I'm not seeing it work, and I don't know how you can it and make it work with equine therapy. Horses are expensive; they cost a lot. The vet bills are high. Ask me, but they're also so valuable, and they change our lives so profoundly that me sitting in a suit in a white coat, I don't think I got that power. So I'm skeptical of it, and I'm kind of sad about it, to be honest with you.
Whenever we do these podcasts, we bring people in with varying backgrounds. And that's one of the themes that comes through is the importance of the relational piece, that the individual, whether it's a therapist or some other professional working with them in a setting of any sort, yes, there has to be the time, the devotion to the individual, not merely checking boxes or using particular technologies according to a proscribed plan by the insurance company or some other sort of detached expectation of what a therapeutic experience should be for any particular set of diagnoses or the pathologies that keep getting assigned to people.
I think it's critical. I'm really concerned. I have a cardiologist. This doesn't have to be recorded. I don't care if it is. My cardiologist left a corporatized hospital because he had 15 minutes a shot with his patients. This guy, he's not even done telling me about his vacation in the first 15 minutes and making me feel comfortable. So I tell him what's really going on. It's human, and we need humans and animals. We don't need algorithms and computers and scales and profit margins. And unfortunately, it's getting more and more in that line. So I'm very concerned about that whole thing. And, I can complain about it. I don't know if I can change it, but I sure as heck can, make a big splash with what we do with horses or what the horses do, in contrast to people going through. I think it's an algorithm. Maybe I'm wrong about that, but the corporate is too canned and too, what's the diagnosis? How many sessions? How long does the session take? What are you going to discuss in the session? How's the outcome? Great. And people.
That's one of the big drivers of this podcast in the first place, was just watching that happen, watching it evolve. Don't know what we can do about it, but we can give voice to it. We can say, look, we can call it out. We can say, this is what's not working for a lot of people. This is the direction of the corporatization. And here are some people that are doing things in a very real, very passionate, experiential way that we just want to broadcast. And that's a big driver of this very podcast. So
I love that you're doing that. I think, equine therapy or even therapy in an office with a person that sets up, that's expensive. Equine therapy is expensive. Horses are expensive. their feed, their vet bills, all that is through the roof. How expensive is depression in a teenager that leads to tragedy? How expensive is that? What's that worth to prevent? Because it sure as hell is prevented in these programs as best we can. So far, it's opened up conversations and dangers that we had no idea were there, that the horses opened up the honesty that was there, and people could get treatment and did get treatment and are alive today. So how do you put a dollar sign on that?
And this is what you're bringing to the community. Maybe this is a good time for you to speak of your nonprofits, the work you're doing with kids. Yeah. I know you're working with veterans. Talk about that, because I think you're bringing this passion and this sensibility to a broad range of people.
It really is broad. Without going into it, we worked with a squadron of special forces troops in West Texas a couple of years ago. And it was absolutely profound. And the whole group, it was a group of 40. It was like one person. They were so in unity with one another. They'd move through the woods and you wouldn't hear a sound. But they loved the horses because the horses weren't threatening. They could just go up with them and pet them and be with them. If I could just start with that, what we're bringing, my wife and I, and my wife of 49 long, wonderful, fulfilling years, have formed a nonprofit. And we also have a website. Our regular website is horsepowerprogram at comcast.net. And that's where the manual for setting up programs called Power Tools for Living is. But we set up a nonprofit, and it's called thrivingwithhorses.com. That's our website. And in our nonprofit, we're going we're applying for grants, because what we want to do is teach other people what 40 years of experience has taught Nancy and me. And we want to be able to teach other people what those experiences are in working with horses and with people, so they can carry it forward. And the knowledge doesn't just end with us. So we're setting up the grants and the funding so that we can do training of people who are interested in how they do equine-assisted learning. They're not going to learn how to be therapists until they get their credentials from an accredited university. But when they do that, they can learn how to work with horses in ways that bring about the changes that we've seen and measured and have statistics for. So our idea is we'll have a group of people coming behind us to carry the knowledge forward. And, I can maybe sit on my old horse and watch it while they do it. And that'll be just great. But we don't want to lose the legacy. And we want to also get enough funding that we can open up to the Boys and Girls Club again, or VTC, Veterans Transition Center, which has a number of veterans suffering PTS, by the way, or the schools with at-risk youth. And we've done a lot of work there. We want to bring them in and not have them have to pay for it, because they can't. And funding is not as available as it was a long time ago. And that's why our nonprofit, thrivingwithhorses.com, is there. And we did a lot of work to get it set up, because we want to be able to reach out, even after we've been here. That's our legacy. I find it a great privilege to get to do equine therapy. I've always loved horses since I was a kid. I rode my first horse when I was 3, based on what happened. And my aunt, who just passed away, is the one who put me on that horse when I was 3, many years ago. It's a labor of love. And being with these animals, it's nothing but joy. Being with people who have the sense of wonderment, to have the guts to try to come there and say, yeah, we'll do equine therapy. What in the heck is that? How's that work? I don't know that it's there. I don't understand. It's joyful and it's exciting to get to do that. It's not as predictable, but in my opinion, it's extremely fulfilling. I wouldn't say it's better, but it's very fulfilling. So to me, it's a blast. When I knew that you were going to do this podcast, oh yeah, I get to see Douglas. We're buddies for 2 decades or more, actually. It's fun and I enjoy it. And the people coming laugh and they smile or they cry and they let us know. And the tears coming down the neck of the horse say a lot. And I've seen that quite a lot. But I guess I'm going to quote a song Cody Johnson, The Ride is Worth the Fall. It's The Fall by Cody Johnson. It's awesome because the ride is worth the fall and the pain and the struggle. You get up and it's worth it. So to me, it's kind of that philosophy.
It's that joy and that passion that's been an inspiration for me in my career for decades now. And I can't let this podcast end, Rob, without asking you to say a little bit about your lifelong passion for the Niners, your early days, and what your hopes are for this coming season.
Well, I hope you've got about an hour, Jenna. Extend the tape. You took me to a Niner game a couple of years ago, and George Kittle was playing in that game, but he was just starting as a tight end. And the tickets you got, we were right behind the 49ers. And I've been a Niner fan since I rode my first horse at age 3. And my family were all Niner fans forever, constant. And when you took me there and George Kittle made this great catch, I was so close, I yelled out at him and he looked right at me and said, "Way to go, man," and gave me the thumbs up. And I'll never forget that. It's joy. It's fun. And last year was nightmare. And I don't even know what to say. And all the injuries. So it drives me crazy. But this year it's going to be different. And we'll see where we go. We got Brock Purdy in there and George again. I love him. And Fred Harper. And hey, it's all those guys. I love the team and I love the spirit of it and the passion of them. I think it's a great group of guys. I wish they'd all come and do equine work and maybe they'd have some passion they carry over there and bring it back to the games. I love the Niners. That I always will. Joe Montana, his number 16 jersey's in my closet.
Well, with that, Rob,
I could go on. But you're my buddy. You're my Niner buddy.
We'll stop the recording and we'll keep talking about the Niners. But it's been an absolute pleasure having you here on the Reframe. It's been wonderful. I encourage people to reach out. We'll make sure we link to some of these resources in our show notes. Dr. Rob Magnelli, thank you for being here.
And Douglas Bodin, thank you for including me and thinking of me. And Jenna, thanks for all your expertise. He's smarty with all his knowledge of computers. It's embarrassing, but you all have been great. So it's been a high point of my day. Thank you so much, Doug.
Thank you for tuning in to this episode of The Reframe. Follow the show wherever you listen to podcasts so you'll never miss an episode. Please share this episode with your friends, colleagues, innovators in the industry, and anyone you feel would benefit from listening. To learn more about the Bodin Group and Bodin Mentoring and find additional resources, connect with us at www.thebodingroup.com.